One of the worst parts about chronic pain is that it's invisible. Others may not understand what you are experiencing so acutely, or even minimize or discount your pain. In this video, I will teach you ways to live with chronic pain and reduce the level of pain you are experiencing. It is not a substitute for medical advice. Please be sure to consult with a trusted doctor about your pain and other health concerns. I am Sharon Dornberg-Lee, a licensed clinical social worker and CJE Senior Life's Clinical Director of Community Services. Pain is real. It's not all in your head, and it can dramatically reduce your quality of life. While pain is very real, it's important to understand that all pain is filtered and processed by the brain. The extent of tissue damage or disease state does not accurately predict the amount of pain a person feels. For example, two patients with very similar MRIs showing disc damage to their spine may have very different levels of pain, or some may have no pain at all. Why is that? The brain has the ability to reduce or increase the level of pain we experience. Learning how to harness the power of your brain via thoughts, emotions, and behavior can reduce your overall experience of pain, and I will explain how. We also have an 8-week therapy group on Zoom at CJE called Strategies and Support for Chronic Pain that goes into these and other techniques in much greater depth. At the end of this video, I'll tell you how to learn more about that group as well. First, I want you to consider these questions. What's most important to you? What could you do that is important to you if pain wasn't as big a part of your life? That is your motivation for doing the mental exercises I'm going to teach you today, and for practicing them long after today, because they do require consistent practice to be effective. The gate control theory of pain helps us understand how the amount of pain you feel is based on what's going on in the brain. Pain signals going to the brain travel through a kind of gate in the nerve fibers of the spinal cord. The brain is not just a passive receiver of pain signals. Brain activity can determine how wide or how narrow that gate is and let in more or fewer pain signals. Thoughts and emotions, as well as behaviors, are all strong gate openers or gate closers. Take a moment to think about that. The pain isn't in your knee, for example. If you have knee pain, your knee sends a signal up your spinal cord to your brain, and you can influence if the gate is open or closed to receive those pain signals. Your thoughts and feelings can either open the pain gate and let in more pain, or close the pain gate and let in less pain. So, what thoughts open the pain gate for you? For example, some thoughts that may open the pain gate include, "Oh no, the pain is never going to go away," or "I can't tolerate this pain for one more day." These thoughts cause you to experience more stress and anxiety, and they open the pain gate. You may want to write down some thoughts that may open the pain gate for you. Press pause on this video now and take the time to write down your thoughts. Now that you have some thoughts on what may open the pain gate for you, you can use the power of your brain to quiet down the pain chatter. Now, what thoughts might help to close the pain gate? Here are some examples of thoughts that might help to close the pain gate. I've lived with the pain this long. I can live with it another day. This pain is bad, but I am strong. These are examples of thoughts that reduce the stress, fear, and anxiety you experience when you are in pain, and that can help to close the pain gate. Take a moment to pause this video to write down some thoughts that might help to close your pain gate. Good. Now you have some ideas on thoughts that may open and close the pain gate for you. Practice substituting the thoughts that open the gate with ones that may help to close it. This will take time and patience. The anxious and negative thoughts that open the gate are likely very comfortable living in your head by now. Start by just noticing these unhelpful thoughts whenever they pop up. Just be aware of them. You can even try kidding around with them. Oh, hello, Mr. Negative or Mrs. Negative. Old friend, there you are. I knew you'd pop up. Once you've learned to notice these thoughts and view them as just that, thoughts, not facts, try substituting them with the more balanced gate-closing thoughts. Things like, the pain feels awful, but it's not dangerous. Or, let go of the fear and just breathe. So we've talked about negative thoughts that increase pain. Now let's talk about behavior that can open and close the pain gate. Pain has a way of making you pay attention. When we are in pain, the tendency is to get depressed or anxious and to draw inward, and this is natural. In the case of short-term pain from a new injury or aching from a virus, rest can help us recover. But with chronic pain, we can get stuck in this cycle of inactivity from pain, leading to worsening pain, and that leads to even more inactivity. A technique from dialectical behavioral therapy called opposite action can be helpful to change this negative spiral. The idea behind opposite action is to help you deal with distressing situations, in this case pain, by setting into motion an action that is helpful instead of harmful, getting up and moving around rather than lying in bed. Again, check with your doctor about your particular condition, but if she recommends you be more active, then try this approach. With opposite action, you move in the direction of an activity, even when you may have a lot of voices in your head telling you not to. For example, throwing off the covers when you feel like hiding beneath them. When I was a smoker many years ago, I called those bad voices in my head telling me to smoke, even though I knew it was horrible for my health, the tobacco lobbyists. Calling them that helped me distance myself from these voices and even to imagine little lobbyists in suits in my head. Be quiet, lobbyists, you don't control me. Can you think of a playful way to engage the voices telling you to sit still and not challenge your body by moving around or making a plan to go out? A mnemonic called vitals can help. Vitals is a gentle approach to things you just don't feel like doing. V, validate experience. When you're in pain, it's natural to want to avoid activity. You should begin by validating that inclination. Of course, you don't feel like doing much when it hurts. I, imagine. Start by just imagining yourself engaging in a little activity. Picture it in your mind's eye. T, take a small step. What is one small step you can take in the direction of a behavior that may make you feel better? Is it throwing off the covers or putting on a pair of shoes? A, applaud. When you've taken the small step, give yourself a literal or metaphorical round of applause. Congratulate yourself. You've taken a step in the right direction. L, lighten the load. Anticipate the benefit of your planned activity. This can help it to feel lighter and remind you why you want to make the effort. This might be reduced pain from moving around more or the pleasure of being outside. What benefits do you anticipate? S, sweeten the pot. How can you positively reinforce the steps you've taken now that you've done them? Give yourself a treat. It could be a hot shower, a snack you enjoy, or giving yourself permission to binge watch a show you like. Can you think of a small goal for this week using this approach? Take a minute to think of one, and then remember to use the vitals approach to move toward it rather than away from it. Today, we reviewed the pain gate theory of pain, and ways to close the gate by changing our thoughts and opposite action to move toward the things that may be helpful but that you may have been avoiding due to fear of pain. To make a referral or to get more information about CJE counseling services, including the pain group I mentioned earlier, please call us at 773-508-1000. Counseling services are billable to Medicare and other insurance. Co-pays and co-insurance may apply and will be identified before services begin. Sessions are primarily conducted via telehealth or in person at CJE Senior Life's offices at the DeLyder Winston Center for Aging Well at 3033 West Touhy Avenue in Chicago, and the Weinberg Community for Senior Living at 1551 Lake Cook Road in Deerfield. Thank you for joining me today.